Good afternoon, everyone, and welcome to the Healthcare Internship Information webinar. For today, we are recording the webinar that will be available on the application page at the end of the week by the latest, and so that you can access that going forward. And so for today, what we're going to do, we're going to do a little introduction about what the actual internship is, as well as give you some information. And then afterwards, we'll have a Q&A with some of our interns as well as our current Honzel Fellow. And this can give you a good insights of what's happening. And then we'll open it up to Q&As of what you have, and we'll be able to answer those. So my name is Guadalupe Hayes-Mota, and I'm the director of bioethics, and I'm the person who instructs the class and also runs the internship. So I'll let the interns as well as the fellow introduce themselves.
Hello, everybody. Thank you so much for joining us today. My name is Maria Sakurets. I'm a senior here studying neuroscience and public health, and I am this year's Honzel Fellow, meaning that I was a healthcare ethics intern last year, and now I get the privilege of serving in a TA role for this year's current interns.
Hi everyone, I'm Sylvana. I'm also studying neuroscience and public health, and I'm a junior and one of this year's current interns.
And then I'm Amalia, and I'm a public health and biology major. I'm a junior, and I'm also an intern.
Great. So let's start a little bit more about the actual internship. So the healthcare internship, what we do is a class where we really start thinking about ethical dilemmas as well as how to apply them in real settings. How it's structured is we are given, it's a class where you meet every Monday for the entire year, and you learn about the major ethical frameworks of how to analyze bioethics. And on top of that, you're able to do an internship. So you're able to put hands on how to analyze ethics, right? And how to do that. So both of those combined will hopefully give you a sense of how to act and be more of an ethical practitioner going into the future. So that's like the basis of the class overall. And that class, it satisfies the LSJ requirements, so it gives you that component. It is a 5-unit course that will be registered in the spring quarter, and it runs through the fall, winter, and spring. The fall, winter, and spring, you will have a class that meets every Monday, and then during the winter quarter, you'll do an internship. For the class, you meet from 5:15 to 7:15 on Mondays, and it is one ethics course. It is a prerequisite for it. If you have more questions about which courses qualify, you can go into the application page and it'll tell you specifically the courses. And if it's not answered through that, you can always email us so we can clarify whether the ethics course does satisfy that requirement. So first, let me talk about the class specifically. So the class meets every Monday from the fall, winter, and spring quarters. And the class is kind of structured in two ways. The first part of the class is we learn about ethical frameworks to be able to analyze the ethical dilemmas that you'll be facing and hearing from practitioners, but also how to analyze ethical dilemmas that you'll be facing in the internship. That's the first part. And that kind of component, I teach that side. And I also kind of base it on my own ethical dilemmas that I have faced as a practitioner. Then the second part kicks in where we actually have practitioners come into the course and teach about ethical dilemmas they face themselves and discuss them with the students in a very case method base, meaning we are mostly taught through the cases and we use cases to learn ideas. And so highly participatory based class where you're able to learn how to create logical arguments about how to be ethical at the end of the day. There are some assignments within the actual class. One of them, the major one, is a blog post. So there'll be a blog post where you'll be able to write some ethical dilemma that you think it's important. And this post will be posted in the Markkula Center, which is quite critical if you're looking into going into grad school or job. It's something you can reference so others can see the ethical questions that you have wrestled and the ways that you have addressed them. So that's one extra bonus for it. There'll also be some reflections as well as reading responses that you'll see through it. So these are some topics that we have covered. Some of them involves ethics in biotechnology, gene therapies, clinical ethics, end-of-life ethics, health equity and access, drug development, talking about the FDA approvals, sometimes LGBT healthcare ethics, also insurance, entrepreneurship. So there's a lot of different types of topics we cover. So it's a big range of them. It's not just one specifically. We look at healthcare as an entire sector. And the speakers also range. We have governmental public health officials that come and speak to us. We have healthcare and hospital healthcare system executives. We also have like ICU nurses as well as physicians, as well as directors in palliative care and practicing physicians as health insurance. So you can see it's a big range of different practitioners. So you can be able to see the full range of different questions you can see in ethics, specifically in healthcare. So a big range of different kind of questions we face. And then the other side is the internship. So the internship happens in the winter quarter, and it requires 16 hours where you'll be matched with a practitioner, mostly in the clinic, and there you shadow them through those 16 hours and learn about and they become almost like a mentor where you learn about different ethical questions and hopefully utilize the frameworks you learn into those questions and how to apply them. And so it gives you a good hands-on experience of what looks like in questions a practitioner faces in a day-to-day basis. So let me talk a little more about the application. For the application, the window application starts March 4th to April 6th, and the application consists of an application form, also a personal statement, two letter of recommendations. Make sure you request those early on because it does take sometimes a little longer for professors or recommenders to write those. Also, you need to submit a transcript. And it's important to highlight that all of these need to be in by April 6th so you can be considered. No late submissions will be accepted. Once those are submitted, some individuals will be selected for interviews, and then after the interviews, decision will be made in early May where you'll be notified by email whether you were accepted into it. And that's a QR code that you can go in direct application. We also send the actual link after the webinar. And that's the LSG applications. So let me stop sharing so we can see each other. And so that gives you an overall kind of sense of where the class is, what we teach, and what we see. And now what I want to do is I'm going to start with some questions. And then afterwards, see if anyone have any questions that will be answered. So let me start with the very first questions. So now first introduce for Maria, what is one moment during your fellowship or your internship when you realize this experience was shaping how you think as an ethical leader and potential practitioner?
Yeah, so I'll be talking about my internship experience last year. At the time, I was a junior and I was working as a dialysis technician at DaVita, whom I ended up writing my ethical blog post about. I was faced with a really tragic situation at my dialysis clinic where insufficient training and resources contributed to a patient's death. Dialysis is a regular supplementary treatment. People come and do it every other day, and deaths aren't supposed to happen in this place. Unfortunately, I was faced with the ethical issue of having to report some of my teammates, some of my coworkers, to management because of some of the issues that went down during this case. And I really had to lean on this internship and the structure, like the support behind it to make the right decision. I hope that all of us can understand that making the right call is really difficult. And I think having to escalate that moment for me was really where I realized that I turned from a mortified observer into an actual upstander, an ethical change agent in the healthcare setting. That was a really big step for me. And I think now, as the fellow, I get to carry a lot of ethical knowledge behind me as I work in the emergency department, where every day I see several ethical issues ranging from how to discharge homeless patients, how to ethically navigate language barriers. I see ethical issues every single day in my work. And I think this experience has been monumental for me when it comes to doing the right thing and doing my best to take care of our community.
Would we like to go next, Sylvana?
Yeah, totally. I want to thank Maria for sharing that. I think it takes a lot to be so vulnerable with what you've experienced, both in life and like as in your role as a healthcare practitioner. Um, Something kind of like a similar realization for me was actually a case discussed in this class regarding the approval of a new Alzheimer's drug by a pharmaceutical company that is really big and has a lot of offices, I think even in the Bay Area. And kind of the dilemma we were given is so there's this new drug, and I think a lot of us have probably also been impacted by Alzheimer's, myself included. So it's a very heavy decision, right? Whether to approve it or not. And if you approve it, there's a chance that patients get brain bleeds. I believe it was a really high number, like 40%, but there's a 60% chance it helps. And kind of the question is, should you allow the patient to decide to take that gamble or their family? Like, is that ethical to place that decision responsibility on them if they're in this really hard time? And then the other aspect that I feel really opened my eyes to like, wow, this is really informing my career choices is because I thought like, this is a very realistic situation because like, I know a lot of SU alumni have gone on to Genentech and similar companies and you may be forced to contribute to one of these decisions and um, what is super valuable to me about this internship is that we're like directly taught unbiased frameworks that help us tackle these issues. And I think that that's like what really is setting me up for a career in public health.
So I feel like for me, I'm currently in the process of writing my blog post. And it's about wilderness camps and like the way that like behavioral therapy for teenagers or like rehab gets um dealt with in some states. I grew up in Colorado and there is a big prevalence of drug usage among teenagers, and there's not a lot of resources for them. And so I've actually had a couple close friends be sent to these wilderness camps in Utah. And I remember hearing about it when I was like in high school and being really frustrated by it. But now I'm able to like actually like sit down with these programs, do a bunch of research on them, look at policies that are like protecting these programs and being able to like use ethical frameworks to look at autonomy and look at like harm and how it's maleficence. You're doing more harm than you are doing good. And I think being able to really just process that with these ethical frameworks just makes me feel a lot more educated about it. And it makes me feel like I can find a solution now because I can really dissect it. And also just like you're gonna get so many ethical frameworks in your toolbox that it's really just gonna change how you think. Like the other weekend, it was like there was some personal issue that I witnessed and I wasn't sure how to go about it. And I was really conflicted. And it has nothing to do with healthcare, but I literally sat down and I pulled out three ethical frameworks and I was like, what would it look like if I chose this versus that? And it really helped me to figure out how I wanted to go about that decision in that situation.
Thank you for sharing that. And when you apply, what did you think this internship would be? And in what surprised you the most once you were inside the work? So I open it up. Whoever wants to take it first.
I can go. Um, I am pre-med, and so I just kind of thought like, oh, this will help me with like clinical and patient dilemmas that might come up. But honestly, like I've had such a wide scope of like healthcare issues, as Dr. Hayes-Mota said before. Like you get to learn about like biotech, you get to learn about like the health policies for different organizations. And I never really sat down to think like, oh yeah, they do have to make those exact same decisions too, and those exact same ethical issues. And it's really helped me to see that there's no, especially in these types of situations, sometimes there's not a black and white answer, and it is very much like a gray area for these decisions that these companies have to make. And so being able to use these ethical frameworks are very important. And it's just really broadened my knowledge on the healthcare system in general.
Yeah, I completely agree. What really stood out to me is I don't know why I kind of had this perception we'd be more just kind of thrown into the deep end. And we definitely, deal with really hard issues. But what surprised me about this internship is that you're very well prepared in the first few weeks of class to deal with these things. Like the lessons are very thorough. And as long as you have like some basic, willingness to learn and a genuine interest in ethics or healthcare or just, the impact of things on people that, you approach from a place of empathy, you're going to do amazing in this class, just with a genuine interest to learn. And then the other thing that really surprised me is, how deep the relationship with your mentor that's a physician is. Because, all we see at the doctor is what happens like with us. And typically, we know exactly what outcome we want. You go and maybe you think, I need antibiotics, or you want something from your doctor. But shadowing the doctor made me realize exactly like Amalia said, it's like so not black and white, and it's really quite astonishing. Like, just the different dilemmas that doctors face every day, depending on, their patient population.
Yeah, just to echo basically what both of you said, for me, this internship was extremely clarifying. When I first started college, I started as a pre-med and I slowly slipped into a very negative mindset because of how hard it is. And I tried to convince myself that I wanted to be a PA, that I wanted to be a nurse, that I wanted to be a CRNA, any other healthcare role besides a doctor, because I just didn't believe in myself because of how tricky it got. And I think shadowing was really profound for me. I don't have anybody in my family that's a doctor. I'm an out-of-state student and I have to work throughout school. So I was just feeling really discouraged until I started shadowing. And I think that really reignited my conviction for pursuing medicine. I felt such joy and clarity singing through me when I was shadowing my physician, and I was lucky enough to be placed with someone who was very welcoming and warm to me. But yeah, seeing the ethical issues in class, applying them in clinic during shadowing, it felt very so well-rounded, and it really resonated with me. I think it reignited my joy for the entire field as a whole and like really motivated me to pursue what it is I want. I think had I not been a part of this internship or fellowship, I would have still been contorting myself to professions that I knew just weren't the right fit for me. So I have a lot to be grateful for because of this experience.
And so before taking the class, what did you think bioethics was, and how did your understanding change over after participating or during participation?
Amalia and Sylvana, I'll let you guys take this one.
Yeah, I can quickly jump in. Honestly, so I took ethics in healthcare just because, like, I actually started college as an engineering major. And then now this internship was also very clarifying for me that I more want to go into like public health policy and like kind of public health like work in that sort of area. And so like I took ethics in healthcare and I thought that bioethics was more abstract. I thought that it was more about like I thought it admittedly I thought it was easier because I thought it would just be questions like, is it ethical to share people's DNA? Like, 23andMe had some big lawsuit recently. And I felt like all the answers are like, well, no, you should all just do what's fair. But like, an interesting thing I saw while shadowing was a woman with Down syndrome. And the doctor was trying to decide an aspect of her care. And, because she has this developmental condition, it was very difficult to kind of discern what the best thing for her would be because we weren't able to ask her. And I think seeing that those type of cases like are what doctors deal with day to day really opened my eyes to like how hard it is to do the right thing, even if you have the best intentions, unless you're educated on, there's a lot of foundational philosophy that we can lean on.
Yeah, I thought that bioethics was like the science ethics type of thing. Like I thought it had to do with like drug development. And as a public health major, like you learn a lot about different types of societal issues and structures. And I just didn't think that was the same thing. And honestly, like learning more about bioethics, you kind of learn that everything is kind of interdisciplinary and it all connects. And like, so you have the science, you have the society, you have structures, you have the clinical part, and it really does all connect. And I just never really realized that. So it's been interesting to learn about that.
Great. And how did the guest lecture shape your understanding of healthcare ethics, and what did you enjoy about it?
One thing that also surprised me about this class, is the density of guest speakers. And I actually really love it. I love guest speakers typically in all my classes, but the ones in this course are all people who have like in their careers faced these actual decisions. Um, Someone who really opened my eyes was a an older professor who lost his wife to Alzheimer's. And he was, basically after that experience, informing a lot of other people and also seeking support himself. And I think that that really kind of shaped my perspective on the home care industry, something I hadn't previously been super exposed to. So I think that just kind of the diversity of the guest speakers is really valuable.
Yeah, for me, one of the most impactful guest speakers we had was an ICU nurse that worked during COVID, and she started right when COVID started. Um, and funnily enough, she was working in the same hospital that I was born in Colorado, so it was a really like small world type of thing. Um, but COVID happened when I was 15. I wasn't pre-med at the time. I had no idea what I wanted to do with my life. I knew it was happening, but I didn't really think about the implications of it as much. And like we watched some videos on it. We watched like podcasts on the realities of what it was like to work in the ICU during that time. And it was just so like mind-boggling and like life-changing. And then being able to hear someone talk about it, I couldn't even imagine like a system that was just like so fractured at the time and like people were being so beaten down when they were working. And it really just made me more motivated to want to fix something structurally with that system so that it never happens again because like it evoked like an emotional reaction out of me. I wasn't expecting it at all, but it was a really, really interesting lecture.
I have loved this year's guest speakers. Speaking from experience last year, I can say that the guest speakers then were a lot more focused on solely clinical experiences. We had a lot of physicians and nurses come in to give talks, but this year I have really enjoyed the breadth of guest speakers that we've got to see. I hadn't realized how much I have yet to learn. There are so many niches that we get to delve into every single class, be it about the justice system and inequalities when it comes to inmates, inequalities when it comes to water, LGBTQ health, and biotech companies as well. I think this year the speakers have really presented us with such a huge top-down approach. And it's really taught me how complex and interdisciplinary all of these problems get to be. I think this year I found myself considering shareholders so much more than I did last year, because of how big the scope of all of these problems have been presented to us.
And can you share what your internship experience has been like and what have you observed in the real healthcare setting? Some of you touched a little bit early on, but if you can expand a little more on that.
I can go to get a little personal. I have been shadowing a family medicine doctor, and she's amazing. I actually know her daughter who goes here. And so it's been a really like great mentorship experience. And actually, at the beginning of this week, I quickly turned into from the shadow to the patient. And she had to act as a provider for me. So it was really interesting being able to like witness her kind of provide for other people and seeing the way she interacts with other people and then it being right reflected right onto me. And it really made me like appreciate the type of care she gives because she's just so good at it. And it kind of inspires me to want to also be that kind of provider that's just always there for everyone, no matter what, even if they're patient or not.
Yeah, I also am like pretty amazed at like the breadth of cases that my doctor sees. So she's also a family medicine physician. And some of the things I've seen so far are caring for pregnant people, patients with developmental conditions, um, patients who came in with like a literal binder of medical issues. And I just think that that really says something about our healthcare system. If these patients, multiple people who came in, with notebooks and someone actually had a binder of just things to discuss. And it's really interesting to see how patients advocate for themselves and how the doctor interacts with them based on how they advocate. Another patient we saw was someone who was unfortunately in their 60s and dealing with the start of Alzheimer's, and they were also super aware that this was happening. So it was just like, a very ethically complex situation of the best way to support them. And their spouse was also there. So it's been really eye-opening because, when you say primary care, maybe some of you had more of a better idea on what it is than I did when I joined, but I kind of thought it was just like very routine. Everyone comes in like, okay, yes, we'll check your medications and you're basically out the door. But my family medicine doctor is that I'm shadowing is dealing with like an insane diversity of cases. And it was also really cool to see like kind of her assessment because if anyone here is like an EMT or anything like that, you'll know the assessment is very just like, you literally memorize acronyms. But the doctor that I watched, she kind of just like asks all these questions that have no formulaic like way to get to them. And it's really fascinating to see like her thought process.
What was really special for me as an intern last year was watching my physician, who was an orthopedic hand surgeon, um, nurture fear into trust. Working in the ER now, I can tell you that surgeons have a special kind of character. In my experience, they are usually cold, they are usually reserved, and they are usually very focused on patient outcomes more than they are in the actual interaction, which is, of course, very important. It's life-saving to prioritize action over feeling sometimes, especially in emergency care. However, watching Dr. Kim, my physician, take care of really scared patients was really, really warm for me. There were several cases in which a patient was horrified of going into surgery where they're sitting in the PACU and they're scared, they're in the gown, they're calling their family, they're crying, and watching Dr. Kim sit down with them, hold their hand, and cater to their needs the best that he could was really, really special because it gave them confidence. I remember there was specifically a case where we had a patient who was undergoing a really minor surgery. She had a cyst removal right here in her finger, and she had to stay awake for this part. Putting her under general anesthesia just wasn't the right course of action, and they were going to numb her up with local and do the excision, right? She was really, really scared, and she was very Christian. So she requested that we play Hillsong music in the OR. Prior to this interaction, Dr. Kim had been playing reggae and Weezer, and seeing him be so welcome to changing his environment and, his home to make it more accommodating for his patient, to calm her down and give her a better outcome and overall better experience was really, really meaningful for me. I definitely took that home, and I hope to emulate that in my future when maybe I get to be in a role similar to his.
Well, thank you for sharing all of that. And when you think about the internship or even within the class, what surprised you the most about the ethical decisions that healthcare professionals face? Like, what was surprising about it?
I'll jump in quickly. I think I touched on this in my previous answer, but just like the diversity of cases, and also like how many different conditions that a family medicine doctor has to manage because my doctor, she's really like the gate to specialists, and I didn't realize how critical that role is. Just, in keeping patient volumes appropriate so that the healthcare system can treat everyone.
One of the things that I have witnessed is that while the provider might have very strong opinions about, accessibility and costs, a lot of the times they're restrained by the system itself. And so it's been interesting to sometimes watch my provider, like sometimes she'll put something into the system as like just a well check so that the person doesn't get charged as much. And it's just like little things within her day that she tries to do to make sure that everyone has access and is getting treated appropriately so that, they don't just get turned away due to insurance issues. And it's just been a very sort of like reassuring thing to see that like you can make little bits of change and help people get access, even if you are working under this really harsh, constraining system.
Yeah, echoing completely what both of you said. I think in my own clinical experience as well, I've learned that it's all about the determinants of health. You learn very quickly that as a physician, your priority isn't just to fix problem A, it's to understand all of the context behind it. Because as much as you can perform a surgery for somebody, you cannot in any circumstance forget about everything surrounding the surgery. Is the patient going to be able to have transportation to go to PT afterwards? Do they have somebody at home that's willing to support them with ADLs or wound care after the surgery? You need to ensure that they have a good outcome, and just prescribing a medication and prescribing one treatment is never going to be enough to cut that one instance and give them a fulfilling outcome. So I think learning that it's all about the context was really, really big for me.
And how did the class and internship change the way you think about healthcare, medicine, biotech?
I think for me, I came in with a really negative perspective of a lot of biotech companies because I was like, oh, they just want to like it's probably because I'm a public health major, but I'm like, oh, they just want to like profit over people. Like they don't really care about that. And then honestly, being able to talk to some of these heads of these companies, like, yeah, to a certain extent, their companies do profit, but at the end of the day, a lot of them do have these like mission driven or like moral driven missions so that and they do care about the health and outcomes of people. And I think it's kind of just humanized certain aspects of biotech for me. And made me more supportive of them and not just immediately against them.
I think that's a really good point, and kind of in the same vein, very ironically, now that, I also want to become a physician, but I have, multiple chronic illnesses and autoimmune disease, so I grew up with a very negative view of doctors because, I had to go through so many different doctors, probably like 20, to get diagnosed with like my autoimmune disease, just because it wasn't super commonly diagnosed in like the early 2000s when I was going through that. And I really kind of just developed like, as a kid, like a hatred for doctors. And I think a lot of kids probably suffer from that if they're getting, a lot of blood tests and shots. But my view shifted from hate as I became a teenager because I think as kids we're just very, prone to that black and white thinking. And now I have like, just the utmost empathy for what the physicians were dealing with me as like a little kid because you know, I didn't realize how much it probably impacted them to see like a little kid that's super sick and suffering. And I just think that like that perspective also co like combined with what Amalia said about biotech, I also was like, coming from a public health perspective, had no empathy for like, people who need to manage money in these businesses because if you don't keep the shareholders happy, in reality, the business won't exist. So I just think that it's provided me with like a very well-rounded perspective in a lot of fields.
Yeah, huge agree with the both of you. I think this year has taught me that it's all about protecting our future. Biotech is a lot more about setting a precedent and survival of the company to ensure that you can continue performing as much good as you can in the future further down the line, than it is about money and than it is about profit. And while it's very easy to think of these companies in a very negative light, once you actually get to talk to the people in charge of them and shoulder the weight of what they go through in a day when making a really difficult decision, you're able to empathize with what's going on a lot more. And I think that gives you a lot more context, um, as a voter, as a citizen of what's going on in this country. I think looking at the money and looking at the impact that following it leads to, was really important for me this year. And it let me empathize with corporations a lot more.
And what skills did you develop through the class and internship that you think will be help you in your career?
I think just in general, like the ethical toolbox that you develop is super, super important. And like I feel like we keep saying this, like you kind of go into things and like, oh, it's black and white, it's black and white, but it's really not. And it's being able to like ground your reasoning in multiple different ethical frameworks because you can't just use one alone. Like you have to kind of use them together and cohesively. And I think that's been very like transformative for me and the way that I approach situations and issues.
I completely agree. And like, something I really had no prior exposure to was like the business side of things. Like anything regarding like healthcare operations, especially in companies or even just, with like insurance. And seeing that in a new light really has informed me more. Like, I would super consider now after this class going to work at like a biotech firm because I think I could contribute positively. And before it was just kind of like, um, you know, very opaque to me because I have no like business experience at all. Like I've never taken, business classes, I'm not a business major. And I think that that is super valuable because, everyone needs to know something about business at some point if you're going into any industry, basically. It applies to all of them.
I think what's most of all that I have taken away from this class is compassion and tolerance. We talk a lot about autonomy in this class, which is essentially the right to self-determination, the right to do what it is you want. And seeing this at work every single day in the ER, I've learned to, I don't want to say hold my tongue. That's what it felt like initially. But now I think I've learned to be more patient and understanding of people's choices, even if I might not agree with them, even if I, the physician, the entire healthcare team, completely disagree with the course of action that this individual.
Equally, Maria, we're losing you.
We also have to treat the person as a whole, never as a means to an end. And sometimes you have to bite your tongue and respect that the person in front of you is just a person, and your only role is to hold their hand and walk with them if they so choose.
And what advice would you give a student who is considering applying to the program?
What I would say is really be completely honest about your motivations to pursue this field. Because, I applied to like a couple other fellowships before this program and I got declined because they weren't now I'm grateful I got declined because I realized they weren't truly a fit for my career path. I was more just like, well, I definitely want to achieve something. I want to advance my career, and I would really enjoy doing like a cool project, so I'm going to apply. But I think because I was like a freshman and a sophomore, I was still kind of figuring things out, and I think that now there's no shame in getting rejected from things. But that's why, in this application, I was just super duper honest. I was like, look, I am super interested in this because what I have been through personally, what I have seen, working as an EMT, and my interest is to do this in the future. And I think that that worked because my motivation is very genuine. Like, admittedly, when I applied to like a fellowship as a freshman, I was just like, I feel like I need to do this to be successful. And, you can still be successful without getting into any programs that your school offers. And I'm sure a lot of people are. But I feel like this has uniquely boosted my success because I am a fit for the program. And I think that, if you really have this genuine interest, 100% apply. Like, just in life, you have to shoot your shot like 100 times to be told yes a couple times. And even if, you don't get into what you want, me getting rejected from those fellowships really helped me learn, how can I convey what I'm trying to say in an application. So I think my only advice for the application is just be super genuine. Genuinely don't use AI because, I think that consulting AI on the outline of your essay or something is a totally different kind of situation based on, trying to then in comparison to trying to just convey your voice because your voice is super important.
I would say you don't need to have the most impressive resume in the room. I think your passion for learning and being open to being thrown into really difficult, complex thinking situations will shine through. And I just think like really push that over the experiences that you've already had. Show that you can be a good person to contribute discussions, right? And like contribute in the discussion. And it's really fun because I feel like everyone in our class, they love to just figure everything out together. And so we have really interesting like debates and discussions and just really show that in your personal statement is what I would say.
Guadalupe, you cut out for this part for me. Would you mind repeating the question, please?
Yeah, of course. What advice would you give students who are considering applying to the program?
Okay. I would say if you've done poorly in your classes, don't worry about your transcript. Just like Sylvana and Amalia said, as long as you have a true passion for this internship, we view applications super holistically. Do not sell yourself short at any point. You do not need the most impressive resume. You don't need a lick of clinical experience. As long as you have like a true drive to wrestle with the gray and get to know peers that are interested in the same thing, you will succeed. If you watch Jubilee videos on YouTube in your free time, you'll really, really enjoy this class. And I find that you'll get to know just through the selection process when you get picked and you're sitting in the classroom with other people that are so engaged in the content, you'll be able to take away so much more. And it becomes less of just a class and more of a community. I think the fact that it spans from fall quarter to spring for the entire year is really important. You get to make a lot of really good friends, and a lot of smart ones too that have a lot to offer to this field. I really appreciate how diverse all of our interns are. By no means is everybody a pre-med. People have interests in biotech and public health. Um, every field that healthcare touches in somehow. Um, we have a person, we have a representative of that in our internship class. So yeah, don't sell yourself short. Apply. And yeah, get ready to delve into some fun discussions.
And one mostly last question. How would you describe the value of this class and internship to someone thinking about applying?
Just like I think we've all touched on before, speaking for myself, this experience has given me immense clarity. Being the Honzel Fellow has been especially special because I'm not just an intern anymore. I get to foster a sense of community and help some of the interns with issues that they run into in their day to day. That has been really, really fulfilling for me. Uh, yeah, I think you get to walk away with a much more holistic view of healthcare, all the parts that it touches, and you get to I think it makes you a better person. I think anybody going into healthcare has an obligation to take an ethics class and understand how nitty-gritty things can get. I think it allows you to empathize with everybody involved in the process that much more. And I think it makes you a more responsible individual, makes you a better person, a better voter, a better buyer, a better consumer. And it also makes you so much more educated. I've been exposed to so much media in this class that I would have never gotten to touch or interact with had I not taken it. Um, and doing it again for the second year has been really, really important for me.
I completely agree. What I was going to say is that, my suggestion is if you have any interest in healthcare to apply. And you may leave, really cementing your desire to be a PA or a physician or a nurse, or you may leave with an entirely different perspective and want to be like a legislator or go into, biotech, become an executive, control more of like the money, or control, like where research funding goes, or you may want to like be more hands-on, like on the ground, like doing public health work. And I think that whatever you go into, even if you decide like, you do this and for some reason you decide like healthcare is not for you at all, you still have a lot of really valuable ethical principles to just carry with you because I think healthcare is unique in that it's one of those fields that really deals with people and those kind of lessons that apply to people will apply in any field you choose.
Yeah, I also think if you're interested in any aspect of healthcare, like you have an obligation to understand all the parts of the system because it truly does affect everyone you ever meet. Like it's everywhere you go. And so you can't just only know about one part of it. You really need to have a more nuanced perspective of everything because otherwise, what's the point, right?
So I'll leave to ask, is there something we haven't covered that you want to emphasize before we close?
Being finished with this class is going to leave a little bit of a hole in your heart. It's going to leave you with a curiosity that's always going to eat at you a little, and it's going to give you such a more colorful. It seems to me like I get to see the world in a different color. Just like how I see language, right? Like the more languages you know, the more colorful your life becomes. I see ethics as a language too. You get to The way that you perceive things, the way that you address issues in your personal life that don't even have to deal with healthcare, changes drastically. The way that you treat people changes drastically. And I found that it ignited like a major curiosity for me. I'm going to want to pursue ethics or chase it down as best I can for the rest of my life, I think. Um, it builds such a good sense of community and it makes you a better person. I'd really recommend that you apply not just to cross a box off on your pre-med application, but really just to make yourself a better person, foster your sense of empathy and decision making. I think before this class, like Amalia mentioned, I saw things in black and white. I thought that you were right or you were wrong, and there was no in between that you could wrestle with. Um, and I think I leave this course with a more holistic approach towards addressing issues that we see in our day to day. I'd really recommend that you apply. And I think you'll leave as a better person and better student.
I think Maria really verbalized something I've kind of been considering myself, which is now that like, I actually definitely want to get like a master's in ethics, a master's in public health, something very tangible that will help me kind of continue in the line of thinking that I've started with this class. And that definitely wasn't true before I was exposed to ethics in this class. So I think that's really unique because, I'm a junior and at this point in my career, I feel like a lot of people know pretty well what they want to do, but just to have something new totally introduced and it being like a real passion of mine has been really cool.
Great. So that's all we have. And we answered most of the questions. So thank you everyone for tuning in. We'll be posting this on the application. And just remember the applications opens today and will go until April the 6th. And if you have any more questions, make sure to email us. You can email me or Maria, and then we can take care of the questions that you give us. Thank you so much, everyone.